Preparedness and Response Plan for Bundibujo Ebola virus disease. The plan sets out the regional risk, the priority actions already underway, and what it will take to stay ahead of this outbreak. A few practical points before we begin. The session will run for about an hour. All participants are muted. We will open the floor to questions after the remarks and presentations, and I will explain how to come in at that point. The session is being recorded, and we will share the press release and the full plan with you afterwards. We have 3 speakers today, followed by your questions. To begin, I am pleased to hand over to the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus. Dr. Tedros, the floor is yours.
Thank you, moderator. Thank you so much. Dr. John Kaseya, Director General of the Africa CDC, Dr. Mohammed Yaqub Janabi, WHO Regional Director for Africa, dear colleagues, partners, and friends from the media. Good morning, good afternoon, and good evening, and thank you for joining us. Earlier this week, I returned from DRC, where I traveled to the epicenter of the Ebola outbreak in the province of Ituri. I saw and heard firsthand the challenges that the communities are facing and that the government and partners are facing as we race to control this outbreak as quickly as possible. The outbreak is moving fast, and we're still playing catch-up. But my trip to the DRC also gave me real hope that together, under the government's leadership, we can bring this outbreak under control. The only way we will do that is through government leadership, community ownership, and close partnership between the many actors on the ground. Today, WHO and Africa CDC are expressing that partnership by launching a joint continental preparedness and response plan. The objective is straightforward. We need to stop the outbreak where it is, support countries that are responding today, and ensure that neighboring countries are ready to detect and act quickly if cases appear. There are several important features of this plan. First, it's a shared plan. The only way to beat this outbreak is through close partnership, working together under the leadership of the affected countries in one coordinated effort, guided by a simple principle: one plan, one budget, one team. Second, this is a practical plan. It sets out what we need to do now together to contain the current outbreak and reduce the risk of future or further spread. Third, it's time-bound plan covering June to November this year. And fourth, it's a costed plan at $518 million. That figure represents the combined effort of Africa CDC, WHO, and key partners, including UNICEF, UNHCR, WFP, the AFRC, and FIND. Africa CDC and WHO are also establishing a joint financial tracking mechanism to monitor funding needs, commitments, and gaps. The plan focuses on core areas: emergency coordination, surveillance, laboratory testing, infection prevention and control, clinical care, and community engagement. It also provides for research logistics and the continuity of essential health services, which are often disrupted during outbreaks. Experience shows that success depends on how well these elements function together. Surveillance must lead quickly to testing. Testing must trigger isolation and care. Infection prevention must protect health workers and patients. And community engagement must be continuous, grounded in trust, and responsive to concerns. This plan builds directly on national response plans in the DRC and Uganda, where authorities are intensifying efforts to bring the outbreak under control. It also supports preparedness in neighboring countries where cross-border movement creates ongoing risk. WHO is engaged at all three levels to support the response. But technical work alone is not enough. Containing Ebola depends on political commitment, sustained financing, and the trust and engagement of communities. This plan places communities at the center because without their participation, contact tracing falters, safe care is delayed, and transmission continues. Misinformation is almost as dangerous as the virus itself and spreads just as fast. Earning and keeping the trust of communities is at the heart of everything we do. We're not starting from zero. This plan draws on lessons from previous Ebola outbreaks and recent health emergencies. Those lessons are clear. Speed matters, coordination matters, and consistency matters. The opportunity now is to act with clarity and discipline, using a common plan to guide a common effort. If we do that, we can bring this outbreak to an end and strengthen the systems that protect people from the next one. This is a serious outbreak, and it's one we know how to stop, but we need to move fast and together. No country faces this alone. As I said earlier, the key to this plan is partnership, especially between the Africa CDC and WHO. I'm therefore pleased to invite the Director General of the Africa CDC, Dr. John Kaseya, to say a few words. John, over to you.
Good morning, good afternoon, good evening. Dr. Tedros is so nice because I was even not planning to make opening remarks because my role today was to make presentation. But let me say, working together with WHO at HQ, at regional level, is what our countries they need, our communities they need. They are requesting that. Our partners they need. Ourselves, WHO and Africa CDC, we need because we are complementary. The leadership of Dr. Tedros at global level is guiding us, is inspiring us. All of us we saw when he was in Ituri, he had even opportunity to celebrate those who are out of this painful moment. This plan that we'll present today is a combination of plans from countries affected, from countries at risk, and from partners. And the process was supported by WHO, Africa CDC, and so many other partners. I want just to thank all of you, and especially WHO, for being today with us to launch this plan. I will come back later when I will make presentation, but let me, I think my brother, Professor Janabi, has some word to say.
It has slightly changed, so it's going to go after you, so you can.
Then Professor Janabi will speak after me. But no, let me first invite Professor Janabi, then I will come. Professor Janabi, over to you. As Tedros did to me, I do also to you.
Dear colleagues, can you hear me? Hello, can you hear me?
Yes, we can hear you, sir.
Dear colleagues, partners, and friends from the media, good afternoon, good morning, and good evening. Just 72 hours ago, I returned from Ituri. There I stood with Ebola survivors and listened carefully. They spoke of pain, of sleepless nights, and of the moments each believed life was slipping away. That is Ebola, not statistics, not projection, but people of Ituri. Today, WHO and Africa CDC launch a joint continental strategic preparedness and response plan. Not as an academic exercise, but as a clear, unified course of action. Our objective is simple and non-negotiable: to stop Ebola, the outbreak where it is, to support the Democratic Republic of Congo and Uganda in their response, and to ensure neighboring countries are ready to detect and respond without any delay. Let me emphasize, Ebola responses succeed only when led at the highest national level. This must be government-owned, government-directed, and government accountable. Partners, WHO, Africa CDC, and others support and reinforce national actions. Countries lead, full stop. The plan reflects hard lessons written in lives lost and lives saved. So first, it is a shared, one plan, one budget, one team under the national leadership. Ebola exploits division. Unity denies its space. Second, it is practical. It focuses on what works: strong surveillance, rapid testing, timely care, infection prevention, and sustained community engagement. And third, it is a time bound from June to November. Why? Because delay costs lives. And fourth, it's fully costed, as you heard from DG, with a joint financial tracking mechanism to ensure transparency, accountability, and discipline. The plan strengthens national responses in affected countries and reinforces preparedness across borders where risk moves. WHO role is very, very clear: global leadership, emergency capacity, and coordination with CDC Africa, anchored in support to the national leadership, working alongside governments, supporting execution, never replacing the authorities. Let me end with this. Plans do not stop Ebola. People do. Protected health workers, decisive leadership, communities that trust the response. From Ituri, the message is unmistakable. I was there. When governments lead and communities trust, transmission slows down and outbreaks end. We know how to do it. We have the plan. Now we must act early together to end this outbreak with a very decisive speed. To DRC and to Sudan and to Uganda, we are not here to fight Ebola for you. We are here to fight Ebola with you. I thank you.
Thank you, Professor Janabi. Now the plan itself. The Director General of Africa CDC, Dr. Jean Kaseya, will walk us through the joint response, where the risk sits, what we are doing and what we need. Dr. Kaseya, the floor is yours.
Thank you so much. Dr. Tedros and Professor Janabi gave us opening remarks. This is how we are sharing responsibilities. And I will make this presentation on their behalf. Let us start with what we know on the ground today. As we are discussing this slide, we need also to say that we are taking everything with caution because situation is moving and because we cannot say that we have the accurate figure. But from the national reporting that we have, so far we have 397 confirmed cases, 63 deaths, with a case fatality rate around 16%, 15.9%, and 5,009 people under contact list. We have also 11 countries at risk, but wanted to show you how this outbreak moved from day one, it means 15th of May when it was declared, to date. We moved from one province, 3 health zones, to currently 3 provinces in DRC and 26 affected health zones. And this is showing that the outbreak is moving, with the epicenter being still Ituri, where we have more than 90% of all cases and 70% of deaths. When some colleagues, they wanted to know why we saw this decrease in terms of suspected cases versus confirmed cases, we are showing that on the 29th of May, we were mostly led by the definition, the case definition given to health workers and community health workers. And based on that, we had around 1,351 suspected cases. But decision was made because we build capacity in terms of diagnostics to test all of these the samples that were stored in Ituri. And the result we got, we moved from these suspected cases to confirmed cases. Today we are talking about 397 confirmed cases. And these 397 confirmed cases are part of the 1,000 samples that were in Ituri and INRB was testing. This is a clear explanation on suspected cases versus confirmed cases, because we know that some journalists were asking us on the change that we saw. But Dr. Tedros made it. Professor Janabi reinforced the message. I was in Ituri myself. As you know, I stopped my engagement with the World Health Assembly on the first day to land in DRC. This outbreak is very serious. You can see, if you compare with the 2 previous Bundibugyo outbreaks, number of confirmed cases and number of deaths, this one is the most serious Bundibugyo outbreak that we have so far. But we said, let us also compare with all other 5 serious outbreaks that we had. And as you know, WHO declared the 2014 outbreak in West Africa a public health emergency of international concern. It was also the case for the DRC outbreak in the eastern part of DRC. But let us stop. Let us take a photo. After 3 weeks of declaration, let us compare these outbreaks. You will see this current outbreak, the Bundibugyo one, is becoming the first one after 3 weeks in terms of confirmed cases. It's also serious in terms of deaths, but as we said, This confirmed deaths, we need to take it with a lot of cautious, because we still have more than 250 suspected deaths, and we need to test and to know if these deaths are related to Ebola or not. That one we can change the number of deaths we are providing, even the case fatality rate. Then, so far, if we rank the 20 outbreaks that we had in the past, this one is becoming fourth in terms of number of cases. But we can see the difference between this one and the 2001 in Uganda. If we continue to report cases in the next few days, that one will become the third one. In the past, when we were in Kampala, we were using suspected cases, we were saying it was the second one. But now that we start to use the confirmed cases, this is where we are. It's showing that this outbreak is very serious outbreak. And we need to treat that and to stop that now where it is. We are discussing the case fatality rate, but we already shared with you, this figure is a temporary one because we are still testing to confirm that the deaths that we have, what we call the suspected death, and also some other studies we are conducting, maybe to give us more information, and this figure will change. Some people are saying what WHO and Africa CDC did. They are late. Let me tell you, we are not late. When we got this information the first day, on the 15th of May, and I made it to President Tshisekedi, I made it to President Museveni. When the outbreak is within one country, it's the sovereignty of the country. When the outbreak crosses the border, it becomes the responsibility of Africa CDC. And this is what we did. By declaring this outbreak, because we knew that two countries were affected, and the same day we had these two countries also declaring that, we started from the first day to take appropriate action. So many photos, but this is just to show you our leaders, they said, they made it clear, this outbreak, the response will be led by Africa with support from partners. And this is what we are doing today. We are leading together WHO, Africa CDC, this response from Africa, supported by partners. We took a number of actions, meeting leaders. You can see photos there. Meeting our ministers, our communities, and what we can today say we made as progress. This high-level engagement facilitated a number of actions. We have today the cross-border activity between Uganda and DRC. Thanks to this high-level engagement, we have the airport of Bunia. Today, we can fly to Bunia because, as you know, there was travel restriction internally. We made a lot of progress by declaring this outbreak fake and fakes. But what is the most important one? My two colleagues, they spoke about it. We went in Ituri. I was in Ituri, listening from authorities, for communities, what they want, what they call mistrust. And based on what they were giving us, we came together to develop the joint response plan that we are presenting to you today. We activated the IMST. Our colleagues are meeting on a daily basis. We deploy more than 200 tons of supplies to DRC and to Uganda, and also to some other countries, including multidisciplinary teams. And we increased capacities in all areas: diagnostics, risk communication, treatment, R&D, So many colleagues today, they will share with us the progress they are making. We know CEP is moving with vaccines. FIND is moving with diagnostics. So many other partners. Gavi is coming with 15 million to support also. We thank all of them. But we still have challenges. These are challenges that are leading the response that we are sharing with you today. We need to restore the confidence of our population. We need to see countries doing business together. It means the agenda of detection is critical for us. We don't want to have a gap on detection. This is the first challenge that we have for a disease that doesn't have medicine and vaccine approved. The third challenge that we have is this insecurity. When we went to this area, I wanted to fly to some of the districts. They told me this is not possible due to insecurity. And this one, we are having dialogue at the highest level to facilitate all operations. Ituri is an area with high density of population where minerals are attracting a lot of people, but also movement of population across some countries, some regions. And this high population mobility is one of the factors of the spreading of the outbreak. We know the status of health infrastructures, including the PPE issue, but let us focus more on misinformation and mistrust. When I was in Ituri, people were asking me, DG, for 19 years that we know this Budibungu outbreak, why we don't have vaccines and medicines? Do you think if this outbreak was in Western countries, we will not have vaccines and medicines? Some of them, they told me, we will not follow you. We will destroy everything because we know these countries, they already have that. They need to come to give us that. So many reasons of mistrust and misinformation. I want to thank and congratulate the government of DRC and Uganda for the wonderful job they are doing to inform and to bring the population together. We start to see result on that. This plan that we are presenting to you has 11 response pillars. Everything that I described is there. We are already familiar with that. And more importantly, let us talk about how much. We are talking about $517 million that we are looking for to respond to this outbreak. Because we got country plans. DRC gave us the plan. Uganda gave us their plan. Each of the country at risk, they gave us indication. For some countries, we got clear plan like Burundi, like CAR, like South Sudan. For others, we gave them an average based on the conversation that we are having. Yes, this figure can change. If today we have more cases in the border of these countries or one of these countries is affected. But so far, we are looking for this money. And a small portion of the money, that is around 173 million, will be for all partners to support countries to respond to this outbreak. We are working together. There will be no reason for us not to work together. We are led by the IMST. Let me stop 1 minute to tell you the story of IMST. This IMST was created, Dr. Tedros, myself, and my sister Moeti in Brazzaville. We are looking for ways to come together to work to respond to Mpox. And today, we are proud to say that this IMST model supported a successful mpox response. And we supported cholera. And today we are also together to implement this plan with your support. We have the last two slides wanted to discuss quickly about this medical countermeasures. Regarding the PPE, we know that there is a company in South Africa. If today we confirm our needs, in the next 6 weeks, they can deliver PPE for Ebola. We'll pursue this route while we are securing other PPEs. Diagnostics. You saw me last week or early this week in South Korea, talking with KH Medical, securing the production on the radio one. This is the only manufacturer known manufacturing diagnostic for all strains of Ebola plus Marburg. But more importantly, we requested them to do the tech transfer in Africa and they accepted. Now we are working for this tech transfer. We are investing around $2 to $3 million to facilitate that. Vaccines, and again for diagnostics, we are working FIND for the whole process. And I think my sister, the chair of the board chair of FIND, will have some few words in this area. Regarding vaccines, we are working with CEPI, Gavi, WHO, Gates Foundation, and others. We cannot accept again to see an outbreak in Africa without this kind of MCM. The same for therapeutics. I want to thank Egypt. They are manufacturing Adamsville. They already sent a quantity of that to DRC, and this is what we call solidarity. Let me stop there and request some of our partners who are here to confirm also their pledges. They will have opportunity, but I will also say we got message from our leaders. They wanted to meet on the 9th of May, but they decided to meet now on the 16th of May because some countries are working on their pledges they wanted to make. It means we'll have a meeting where Dr. Tedros, Professor Janabi, and myself will present to our leaders, head of state, on the 16th of June by also getting their pledges. So far, we got money from Equatorial Guinea. Thank you so much. From South Africa, thank you so much. From Egypt, thank you so much. And we know that so many other African countries are coming. Thank you to all of you.
Thank you, Dr. Kaseya. We now open the floor to journalists. Here is how this works. You can please rename yourself with your name and media outlet. If you have a question, please use the raise hand function, and I will call you by name. You can also type your question into the Q&A box. When I call you, please unmute. Please let us know who you are addressing this question to. And please keep to one question so we can reach as many of you as possible. So let's take our first question from Jenny Lay Ravello from DevEx.
Hi, Saran. Can you hear me?
Yes, we can hear you.
All right. Thank you so much for taking my question. I'm just going to ask about funding. So this response plan is seeking to raise over $500 million for several months. But I understand, and this is a question to Dr. Kaseya. I understand, I think it was last week you mentioned about some donors or funders backing on some of their commitments. Can you just give us an update on the funding situation? Have donors recommitted, or what's the current situation on funding? Thank you so much.
Thank you, Jenny.
Second question.
The second question, Nina Larson, AFP.
Yes. Hi. Thank you. Can you hear me?
Yes, we can hear you.
Great. Thank you. So I just wanted to ask about the way the cases and the deaths are being counted now. So the removal of the suspected cases that now seem to give the impression that this outbreak perhaps is smaller than it actually is, since we know that there are still a lot of suspected cases. It was mentioned that this was that this indeed is a very serious outbreak, and I'm wondering what the concerns are looking forward. It's now the fourth most serious of the Ebola outbreaks. Are we expecting it to? Are you looking at it becoming as big as something like what we saw in West Africa, or is it not looking like it's on that trajectory? Thank you very much.
Who do you address this question to?
It could be to Dr. Tedros or to the head of the CDC. Thank you.
All right, thank you. Let's answer these two questions first. So first question over to you, Dr. Kaseya.
Thank you so much. I think I shared my screen. You can see that we wanted to be transparent, mostly to tell you that this is what was communicated to us. When we had this meeting last week, Monday, we got pledges around 498 million. Then some of our partners started to correct the figures. Now, what we are presenting is what partners they shared with us without changing this figure. Is it real money? No. I was talking with the PS Uganda yesterday, who's acting minister. She said, DG, I didn't receive even 3 million from partners so far. DRC minister is also struggling. Then we'll keep our partners accountable. You gave us figures, we want to know where this money, how this money is becoming real money. But let me stop there. I wanted to show you so far what we have as pledges made by partners. Next question.
Thank you. So the second question was addressed, it was a bit open, so it was addressed to either Dr. Tedros, if Dr. Tedros could take this one, or Professor Janabi.
Okay, thank you. Is Dr. Tedros taking it, or I can go ahead? So let me address, if I got the question properly, the Budebunyo of 2026 outbreak, it may feel more serious than those of 2007 and 2012. At first glance, this may seem surprising, but after all, the virus itself has not fundamentally changed. But the reality is this: the level of risk we face today is shaped not just by the virus, but by the context in which it spreads. First, in 2007, we recorded just over 100 cases. In 2012, fewer than 40. Today, as you see, DG Kaseya has just presented, we are already seeing hundreds of confirmed cases and potentially more suspected cases within a much shorter period of time. This tells one thing clearly, as in a public health perspective: the outbreak is expanding faster than before. The second, unlike the previous outbreaks, that remained relatively localized, this outbreak has moved across the borders almost immediately. From the Democratic Republic of Congo into Uganda, the virus is already demonstrating its ability to travel. And with movement comes risk of regional amplification. The third thing, the way I look at it, evidence suggests that transmission was happening for weeks before it was recognized, because the test kits we were using, they were test kits for Ebola Zaire, and this is Budibunyo. So during this time, people are getting sick, but the disease was not correctly identified. This silent spread is usually dangerous because by the time we responded, the virus already was ahead of us, as Dr. Paluku or Tedros said before. So this means cases were missed, diagnosis was delayed, and response was slowed. In an outbreak, time lost is transmission gained. The fifth thing I think which I look on is, unlike other Ebola strains, there is no widely available vaccines or any specific therapeutics for Budibunyo virus. This leaves us relying mainly on early detection, isolation, contact tracing, and supportive care. So all essentials. And I think the sixth thing, we are dealing with a very fragile health system. Hard to reach communities, high population movement. We as WHO, the top leadership led by Dr. Tedros, Dr. Chikwe, who is still there, we decided Chikwe should continue to stay there to try to stabilize. And our regional director on emergencies, they are still on the ground. So this condition make it very hard to trace contracts. We are at 45 today, and our target is to reach above 90. So without this, interruption of transmission will be very difficult. And finally, we do not yet have the full picture. Many cases are still classified as suspect, but we are glad that from beginning of this week, we have managed to clear all of them. So I think it will be a very simplicity to, at this stage, to just classify it. Because today we are facing faster spread, delayed detection, cross-border, limited tools, and a very complex operational challenges. Back to you, please.
Cullinan for the Telegraph. Would you please unmute yourself?
Hi, can you hear me?
Yes, we can hear you.
Yes, great, thank you so much. I wanted to ask about the shortages of PPE. What exactly is missing and why? What are the roadblocks? I've heard that there's it could be related to the Strait of Hormuz and sort of manufacturing problems, or is there other sort of chokeholds to do with logistics and importation? Is it to do with the government and the DRC? And yeah, this can be answered by Dr. Tedros or Dr. Kaseya. Thank you so much.
Then I'll take another question before any answers. So Emma Farge with Reuters, please.
Yes, good afternoon. I was wondering if you could just clarify, will the 315 million go towards the 6-month plan, or is that separate? And can you tell us how many healthcare workers in Congo have now been infected to date and how many have died? Thank you.
Thank you. So the first question.
Yeah, because we have also our colleagues, will give opportunity to our experts to respond. You can see on your screen, you have Rosemary and Yap showing that Africa CDC and WHO are working together. They will answer to the second question. The first one, Chanel, please go ahead.
Great, thank you. Can you hear me? There's just an echo. Great. So thank you for the question on PPE, which obviously is a critical medical countermeasure to protect health workers and and patients. So in fact, there have been shortages at the community level, primarily due to local supply chains and the challenges of the multi-hazards that are faced in country. So whether it's security or just the amount of supplies that need to be moved on a quick basis. In terms of the pipeline, there have been, well, a good portion of the 200 metric tons that have been brought into, Uganda and DRC, but primarily DRC, have been Ebola PPE. So the pipelines are strong. We know that at least 80 metric tons have been brought into Bunia, and now the teams are supporting the ministry to get these moved to the locations where they're in need. Thank you.
But maybe before our colleagues, let us also recognize the Director General AMA, African Medicine Agency. She's on this call, and as you know, everything we are doing on MCM, the regulatory aspect is sitting with AMA. Thank you, Mimi, for being there. And sorry, maybe I didn't recognize you, but we want to recognize the wonderful job you are doing. Then Rosemary and Yap can help us.
Okay. Thank you. Good afternoon, everyone. So far, regarding the number that we have, 34 healthcare workers has been affected with Ebola Bujumbura in DRC. And we also have a 7 deaths between the 34 of those cases. And we also have 6 that have been recovered from that disease. I think it's really important that we also notice that those were people who were working at the center at the time they were affected. So it's also worth mention that we are putting in place the survivor program. It is a program that will follow all the survivors between 6 to 18 months in order to make sure that the virus is not retained in any of the body secretions. I will give the floor to Yap. You want to add something?
Yes, thank you. Just to highlight that those 6 who recover healthcare workers was out of the 8. And then we were pleased actually and honored to deliver the certificate together with Dr. Tedros. And those are also the colleagues who have been fighting the outbreak, but now we become the ambassador. Those are the ones who will go in the community. You are all aware of the challenge that we've been facing with community engagement. So we are going to rely significantly on them to ensure that we keep pushing, sending the message that once we have the symptom, the place to go is definitely the health facilities. So this is an important work, and also it's an opportunity to encourage all the healthcare workers, the community, because the fight is long. It's a marathon, it's not a sprint, but having those good news is also important to share. Thank you.
Thank you. Thank you, and back to you, Madam Chair.
Thank you both. Just for journalists to know, so this was Dr. Marie-Roseline Bélizaire and Professor Yap Boom. Marie-Roseline Bélizaire with WHO and Yap Boom with Africa CDC. I'll take now a question from Kat Lai with The Guardian.
Thank you. I wanted to ask, because I can see a focus in the plan on it being very member state led, but I know that in the affected region, there are some significant non-state actors. So I wanted to ask how you're engaging with them and kind of what the response has been. And that's to whoever feels best placed to answer.
Okay, thank you very much. We'll go to Sophie Gardner from Politico.
Hi there, can you hear me?
Yes, we can hear you.
Thank you for taking my question. I wanted to ask about the situation in Kenya with this American plan to build a facility to house Americans exposed to Ebola. There were reports of widespread protests in the country over that plan. I was wondering if those are still ongoing and whether Africa CDC or WHO are involved at all in the discussions of whether that's going to move forward. Thank you.
Thank you. So first question, who would like to answer the first and second question, because they were
I will answer in Kenya.
Okay. So who would like to answer the first question?
Okay. Let me say that Professor Janabi will answer the first question. I will answer the second one. Look, I had opportunity to discuss with the equivalent of Prime Minister in Kenya. And I had also opportunity to discuss with other senior officials, because we need also to recognize the country leadership and the country sovereignty before making comment. What they explained to me, Kenya has a preparedness plan. Kenya being a hub, the government called for a meeting with all partners to see how they would support this plan. And this plan had 23 centers for isolation and treatment. Then there was an offer made by the US. One of the 23 centers can be used rather than sending people to Europe. As you know, the case that we had in DRC, they sent that person in Germany. They can consider having one of the centers in Kenya as the hub. This is the information that we have. We respect Kenyan authorities for the decision they made. We are supporting them for the preparedness plan, and they know if they need support from Africa CDC, from WHO on any issue that they can face, we are there for them. Then maybe Professor Janabi will take the first question.
Yeah. Thank you, Nick. If I may direct this question to my colleagues on the ground, Dr. Chikwe or Dr. Roslyn, please, about non-stakeholders.
Okay, maybe we can start, and then Dr. Chikwe and my colleague Africa CDC can complete. So yes, so far we are meeting in the ground with all the sectors. Not this morning, for example, we have the meeting with the Federation of Entrepreneurs of the Ituri province. And they are a very powerful community, because they were telling us, if you see the development in the city, it's because of the private sector, and they don't want the outbreak to stop, that development that they are really doing. And if you have been in Ituri 5 years back, you can really see the development, what is ongoing really in Ituri. So they are very involved and are really keen to support all the activities that we are doing. Yesterday also, Yap and I, we met with online with the mining sectors. A lot of big company, they are also worried, first of all, because they have a lot of, population working in those minor companies, but they are also keen to support any action, any activities that they can, implement. We have a meeting with community leaders, with the women leaders, youth leaders, a traditional healers who is playing a key role in that outbreak. Because when you look at the culture, reason why you will see, if you look at the plan, if you read the narrative, you will see that the plan is also embedded in the contextual culture here. People here, when they are sick, they don't come first to the medical doctor. They go to the traditional leaders. So we need to work with those traditional leaders. So at the same time that they receive them, so they can also make orientation for those patients to come to us. However, we also provide them with IPC material, PPE, with all the material that they need in order to protect themselves. We have a meeting also with motor drivers, because in the city, motor drivers are very, I can say, a key that are transporting patients, to hospital. So we met with them, and they are telling us what they want. So what we are really doing in the 2 weeks, my colleagues from Africa CDC and I, we came to the field, is really to listen. Because the community, they know what they want. They know how they can stop that outbreak together with us. And they are really telling them where they want us to put, for example, station for hand washing. They want also us to give them SOPs on how they can protect when they are transporting a patient. If they are using, for example, the helmet, how they can disinfect it. So it's really interesting, to see how all the non-state actors are involving in it. So far, we also have a group of private sector who is meeting, I think, with so many times, and they want also to be part of this response and to support, and also mostly in logistic part, because they are providers as well, but they also want to be donors in order to support this global solidarity. Yep, do you want to have something?
Yes, just to mention that you will realize that in the plan we have one critical pillar, which is the one for continuity of essential services. And it's not only about health services, it's also about all the others, the education and others. So this morning we had the opportunity to meet with the different clusters, people who have been there supporting the environment, but also in the education and other access. So just to highlight that this plan has an emphasis on ensuring that outbreaks is an opportunity to strengthen the existing system, which include the non-state actors. Over to you.
Over to you, Madam Chair.
Thank you very much. I think the answers are great, but I think we'll also try to be a bit more concise because we have so many questions and I think it's worth taking them. So I will go to Dragana Jovanovic from ABC News. So given reports from Ituri that PPE stocks are critically low, and that most existing isolation treatment facilities fall well below required standards, with health workers lacking proper dedicated camps for working, resting, and minimizing cross-contamination, as was the case in earlier outbreaks. How is the new continental preparedness and response plan addressing these foundational gaps? Specifically, what is the current number of fully equipped and staffed ETCs in Ituri, North Kivu, and South Kivu? And when will sufficient high-standard treatment centers with separate staff accommodations be operational? Who would like to take this question?
People in the field.
Yes, so Dr. Professor.
Okay.
Yeah.
So I will start and we can. So what I can start saying is that what we are witnessing here is a very weak health system. So it's true, we were doing an assessment. The first thing that has been conducted is an infection prevention and control assessment. And the level of IPC in the scorecard was between 3 to 7%. While that if you want to guarantee that the health system will not be a cross infection ward, it need to have at least 90% of those infection prevention and control measure in place. So that means we're starting very low to see that. And so far, what we have been done to address that, we have in Ituri alone, identify more than 800 healthcare centers that need to be upgraded in that response. So what we did, we cannot go with all of them at once. We prioritize, and we prioritize 87 that we need to upgrade their level of infection prevention and control. All those centers has received the material they need. The healthcare workers has received the briefing that they need in order to know how to use this PPE, how to make a cleaning as to protect, the health of the population in those work also. That work is already done. And we also identify hospital where we can put isolation room in order for suspected cases before they can be transported to the ETU, Ebola treatment unit. So this work has been already done. So however, as I mentioned, what we are seeing now is a weak system. It is where I want to do that message today, investment in preparedness. Because now we are preparing the system in order to respond. The system was not ready. And when you come in a system which is not ready, you have to make it ready to be able to respond. Reason why we have to build ETU with a tent. Reason why we build to quickly build ETU. Fortunately, we have found in the community a unit that has been built for pediatric services. We have been able to quickly repurposing it, and it's becoming like a reference center for Ebola treatment in Ituri. So far, we have MSF with the building and ETU. We have also a Samaritan Purse, we have Alima, and we have IMC. I think in the next week, we will have at least 5 standard Ebola treatment center unit functional in the Ituri. We have actually a capacity of more than 200 beds that are available, and they are receiving patients. But the challenge remains, as you mentioned. It's a big challenge because, as you see, the number of cases are increasing, and also so the number of alerts and the number of suspected cases. All suspected cases should be isolated from the community in the meantime that we can have the response from the laboratory. So let me stop there, and I see, yep, we can add.
Yes, I think this is also an opportunity to emphasize the solidarity between the two countries affected, Uganda and DRC. So Uganda is working closely with the DRC to see how to support the establishment of 2 ETC around the border, around the Kaseya. So the team are working together, and hope by next week we should be able to start to see the beginning. But on top of that, there will also be support on the side of the lab, with the mobile lab, just to emphasize that this outbreak is also an opportunity to strengthen that cross-border collaboration and the solidarity that we want to see amongst our countries.
Maybe last thing, I think there's a question on the number of PPE. So far in this, I think we are at 18 days of the response. 18. So we have received more than 80 tons of material. It will not be enough. We need more material because all those number of infrastructure I mentioned, they need the material. The material is not only for the ETU. We need PPE material for all those hospitals. So now we can make sure that the population is really safe when they are going to health infrastructure. So I really want to emphasize on that, because sometimes they can mistake that we need only PPE only for the ETU, the Ebola treatment center, but it is not. The PPE are being distributed, but not the same level, but they are being distributed in all the health infrastructure that we have prioritized. But it doesn't mean that have been not prioritized will not receive. That means they will receive in a second distribution. Thank you, and over to you, Madam Chair.
Thank you very much, Dr. Belizer. I'll take the sort of last, but we have a couple of questions. So there is Rachel Abuja from the News Agency of Nigeria. Please unmute yourself.
Thank you very much for the opportunity, and I'd like to commend the DGs. But my question is specifically for Professor Onyekwazu. I would like to know, Dr. Chikwe, if there's a correlation between the mining and the active strain circulating at the moment. Thank you, and over.
Thank you. So I'm going to take the other question, and we'll get back to, and we'll get an answer. So there is a question from the BBC. Okay, give me just a second, because I think this one, okay, there is a question for BBC, and we would like a Swahili answer by Dr. Janabi. So the question is, they want you to speak in Kiswahili on funding challenge. Will targets be met? What is the challenge? The second one is issue of community mistrust. Communities are still attacking burial teams, the latest being Katana. So let's go to the question from our colleague from Nigeria, and then we will have Professor Janabi answer the other question or 2 points in Kiswahili. Thank you.
It was Professor Chikwe, Dr.
Yes,
Chikwe.
it was for Dr. Chikwe. Just, can we see? Okay, so we'll first, so please, Professor Janabi, could you please answer the question in Kiswahili?
then you can answer the first question on behalf of treatment.
No, asante kwa maswali mazuri. Kuna maswali mawili hapa. La kwanza linahusiana na fedha na la pili yaje hili tatizo la Ebola pale Bunia. Kwanza nianze, nafikiri umesikia leo nahitaji karibu 517. Kwa hiyo changamoto iko hivi kwamba kuahidi kwamba utatoa hela na kupokea hela ni vitu tofauti. Kwa hiyo tunaomba wadau wetu wote ambao wameahidi kutoa hizi pesa wafanye hivyo haraka, kwa sababu kadri tunavyochelewa ndio kadri uambukizaji utaongezeka. La pili, kuhusu hili la jamii imepokeaje, naomba nieleze kwa kifupi sana. Mimi nimekuwa pale Ituri, nimerudi masaa 72 tu yaliyopita. Kitu tulichokiona pale, tulipata nafasi na Dr. Tedros ambaye ni mkurugenzi wetu mkuu na jina lake pale la Kikongo ni Paluku. Tulikaa na wazee, tulikaa na viongozi wa dini, na nafikiri siku ile tulikaa mpaka saa 6 usiku karibu. Tulikaa na viongozi wa vijana, tulikaa na waganga wa kienyeji. Pale mwanzo ambapo tulikosa nini, mtu anaumwa anakuja hospitali, anapimwa malaria haipo, anapimwa typhoid haipo, anapimwa Ebola haipo. Zile kiti tulizokuwa tunatumia kwanza ni kwa ajili ya strain au aina ya Ebola inaitwa Zaire, ndio maana majibu yalikuwa yanakuja negative. Sasa binadamu yote, mimi nimekuwa nikifanya hii kazi zaidi ya miaka 30 ya udaktari, kama hujampa jibu anaenda kutafuta jibu, na hasa baada ya kuingia sisi na lugha ambalo ni la kweli kwamba hatuna chanjo wala hatuna tiba kwa sasa hivi ya Ebola, watu wakaanza kwenda kwa waganga wa kienyeji, na ndo pale ilipoanza kwamba hii labda ni sumu, ile sehemu ni ya madini. Mimi nimepata experience nilipokuwa Meralani kulipotokea mafuriko, kwamba watu wa madini walikuwa wanatuambia kwamba kadri watu wengi wanapokufa ndo madini yatatokea mengi. Ni kama sijui ni sindiko au ni mizimu. Kwa hiyo ya kwetu sasa hivi ni lazima tutoe maelezo ya kina, tuwasikilize wale wenyeji wa pale nini wanachokihitaji. Lakini mwisho kabisa, hili najua mkuuliza, tatizo kubwa hili linaanzia kwa wanyama. Pale kuna nyama pori, kuna hawa popo wanaokula matunda. Nafikiri tukitaka kutatua tatizo la Ebola ni lazima tuanze kufikiria tutakaaje na wale wananchi wa pale, tuanze kuwapa elimu jinsi ya kutayarisha, sio kuwakataza kula, kwa sababu kama tukuzuia hile, tukiendelea na hivi vitu vingine ndio vitasaidia, lakini itatokea Ebola ingine na itatokea ingine na itatokea. Kwa hiyo hili kitu sisi kama shirika la afya tumeshaanza kuliangalia. Back to you, moderator.
Thank you very much, Professor Janabi. For the first question will be answered by my Africa CDC colleague, Dr. Wissam Mankola.
Okay, thank you so much. As you know, the outbreak is happening in an area where mining is common. This is why we notice some of the infection happening between miners. And this is actually raising a concern because the mobility of those miners across the border. So there is the risk for spreading across border. This is why we're seeing the outbreak starting from DRC and moving to Uganda. But we cannot say that this strain highly targeting the miners. Thank you.
Thank you very much, Dr. Mankola. And
maybe I can add something if you allow us.
Okay, just concise, but definitely it's loud.
Yeah, no, absolutely, because it is important to understand, you know, we have a very big mining population. And in this mining population, they can be also presenting with the minings. And the symptoms were the same as when they are giving that poisoning. So reason why there was that confusion between the poisoning from the mines and also the Ebola symptoms. At the starting, they believe it's come from the normal work because, you know, each work that comes with the exposition. they believe it was from the normal exposition to the mining. So it was also one of the delay that we registered. And also when we look at, we have made an analysis when we use Vodacom data of those people who have been infected in the mining. So they need to take the gold and to go to sell this gold around. So when you look at, we make out the tracing of their movement, you can see how the trade is also taking them. So what I want to add here is that it's not only a health security issue, it's an economical issue, it's a development issue. This is the reason why this outbreak is also so complex. Over.
Maybe just one thing, if you allow Saran to ask, is the One Health approach. Sorry, Saran. The One Health approach, which is one of the big change in this plan, to ensure that we understand the environment, we understand the animal, because as we do speak now, we still don't have where this virus is coming from, which animal, what was the reservoir, and all those questions with this pillar will be answered. Over to you.
Thank you very much. So this is the last question coming from Abdullah Sani. Please unmute yourself.
Hi, Sharon. Thank you so much for taking my question. DG Kaseya, my question goes to DG Kaseya. Thank you for the presentation. And in one of your slides, you projected the Financial Times op-ed that you published recently. It's weird to me that in that op-ed, it doesn't mention the World Health Organization at all. And also Dr. Tedros doesn't mention Africa CDC in his letter to the DRC. I'm just trying to understand what is the working relationship between these two organizations. And there are two separate trips to DRC. The WHO went on a separate trip. The Africa's EU went on a separate trip to the DRC. Can you tell us, how are you two working together? In your presentation, I was expecting to see a sort of work chart flow between the two bodies, but I didn't see that. So I would love to get some more details from you on how you do that. And also,
it was just one question per journalist. So thank you so much. Let's give some time for Dr. Kaseya to answer your question. Thank you very much.
Look, I like your question because you are giving us again, Dr. Tedros and myself, opportunity to share again and again how we are close, not only at professional level, but also at personal level. The op-ed to Financial Times was not addressed to a specific body. It was what Africans, they want. And when Africans, they want something, they make it clear. It's not, if we name one or another organization or we don't name, this is not the issue. The issue is, what is the aspiration of African countries about what we call the agenda of sovereignty? Today we have so many leaders being vocal on that. But we are clear in Africa. I was with President John Mahama in Geneva, invited by WHO. But this is a champion of health sovereignty in Africa. We in Africa, especially in Africa CDC, we know the place and the role of WHO, and we are working closely together. This is why even today we are launching this program together. I think regarding all other aspects of our collaboration on the way we are presenting the budget, you see we didn't provide a breakdown on the partners' budget. But you can see, look, if it was COVID, Yap and Rosemary, they will be infected today. You can just see the way they are sitting together. This is showing the collaboration that we have between WHO and Africa. And when we'll unpack this budget, where we are talking about partner support, you'll see how WHO and Africa are complementary. I think this is the main message today. We are together, not only with WHO, but with all other partners, UNICEF, FIND, all others. even other AU organs have talked about AMA, about AUDA, NEPAD, and others. I think this is how you have to take it. Don't divide us, please.
Thank you very much, Dr.
Maybe
Kaseya. Should we?
I will add to that.
Okay.
Karen?
Yes.
Okay. So I just would like to add to what my brother Jean Kaseya said. On the op-ed in the Financial Times, I fully agree with the message that actually he conveyed. African leadership is very important for this, and Africa should lead. I am a very strong believer of that, and he didn't say anything different from what I believe. As you may know, the idea of Africa CDC was proposed in July 2013. I proposed the idea when I was foreign minister. This is at an African Union summit in Abuja. You can check that in July 2013. And the whole idea was exactly what Jean said in his op-ed. The importance of, it was proposed because of the importance of continental institutions to lead continental matters. But not only Africa CDC, later Africa Medicines Agency was also proposed. And as WHO, we supported both. We supported Africa CDC financially, technically, and we supported Africa Medicines Agency financially, technically, both. Of course, the financial, as you know, we are not a financing agency, so it's a small one, a catalytic one, but we did. So I don't know where this question is coming from, but what he said is actually a strong position also by me. So I would like to assure you that there is no problem. Then on the travel to Ituri, to Bunya, I was in the middle of the World Health Assembly. So there was no way that I could just leave the World Health Assembly and go to the field, because almost all member states, more than 190, were in Geneva. So we had to finalize. But Jean couldn't wait. He had to return. He had to go to Ituri, to Bunya before me. So, you know, if we try to align our trips, I would delay him. But on the other hand, I can't also leave the assembly and join him. So he went ahead of me, and then, of course, I followed on a different date. It was actually good that he came ahead of me and then followed him, because instead of going together, it could even help if there is staggering. So I'm there when he's not, he's there when I'm not, so that can actually help. But that was the reason behind it. But it's not the trip from us, you know, going together, which is important. Our colleagues, you have seen Mary and Professor Yakubu together on the ground, even answering to the questions. So our colleagues are working on the ground together. I met them when I was there, and we had a partners meeting. So that's the most important. So we will work together and continue to really support the government of DRC and others to stop this outbreak as soon as possible. And the alignment on the SPRP, for instance, today we're launching it together. But not only that, the incidence management system is also co-led by both of us, Africa CDC and WHO. And that's why on the ground, you see our colleagues together. So we're together in this. And I'm actually glad that the Africa CDC that I proposed in 2013 is now grown up strong and partnering with WHO. I have one daughter, but I call Africa CDC also my daughter. And I'm glad to see this kind of partnership and showing the maturity of Africa CDC. And I don't think you have to worry about any problem between us. We are honest partners and strong partners, and I hope this will continue. And any global institution like WHO should recognize the role of continental organizations. Not only in Africa, we need strong continental organizations in other regions as well. And of course, strong capacity at national level. So if you have strong national capacity, strong continental institutions, and then there is global institutions that coordinate globally and strong ones, then that could give us even better leverage, whether it's in preparedness or response. So I want to assure you that we have that same position and mentality when we work together, and we will continue to push in the same direction. But I'm really glad to see Africa CDC growing from strengths to strengths, because for me it's personal, because I have a connection from the start. Thank you.
Thank you very much, Dr. Tedros. We are in this together. I will now talk to Dr. Kaseya for your closing remarks. Then it will be Professor Janabi and then Dr. Tedros.
Thank you so much. Ladies and gentlemen, today we have shared difficult facts. This outbreak is serious. In just a few weeks, we have seen the Bujumbura Ebola outbreak spread across borders, affect healthcare workers, disrupt communities, even pushing for travel restrictions. We must not underestimate it, but we must also not fear this outbreak. History teaches us that we can stop Ebola outbreak. When West Africa faced the Ebola outbreak in 2014, the world feared the worst. Yet, that outbreak was eventually controlled. During the 2018-2020 Ebola outbreak in Eastern DRC, despite insecurity, population movement, and immense operational challenges, transmission was brought to an end. Today, we face a different challenge. We do not yet have approved vaccines and therapeutics for this strain. But let us be clear, and let me be clear. Vaccines and medicines are important, yet they are not the only tools that stop Ebola. We know from our own experience that rapid detection, contact tracing, isolation and clinical care, infection prevention and control, community engagement, trust, solidarity, and coordination are powerful tools that can help us to stop this outbreak. These are tools that have defeated Ebola many times without vaccine, without therapeutics. Today, Africa CDC, WHO, we are standing with all of our partners to support DRC, Uganda, and any other at-risk country. Not waiting for the outbreak to go. Dr. Tedros told you from the day zero, I had a call with him. We divided. We said, let us support from day zero. No one can accuse us to be late. We are acting now, but we cannot do that alone. Today, I call upon our partners, our member states, our donors, our research institutions, our manufacturers, and the international community to step forward. We need more resources. We need more resources from you to have more diagnostics, more operational support, more investment in preparedness across Africa. We don't want again to see African countries shaking when there is a disease. We need to be well prepared with all tools. I call upon the media here today. You are not only witnesses to this outbreak, you are part of the response. Help us to fight misinformation. Help us to amplify facts. Help us to build or rebuild trust. The situation is serious, but it's not hopeless. If we act as we are doing today, with consideration of our countries, with decision, this outbreak will be contained. And I know we'll contain that very quickly. I want to thank WHO. I want to thank our member states. I want to thank our communities for the work we are doing together with all other partners. Thank you so much.
Thank you, Dr. Kaseya. Over to you, Professor Janabi, for your closing remarks.
Dr. Tedros, or the way you are known in Ituri, Dr. Paluku, distinguished colleagues, Dr. Kaseya, and our colleagues media. As we close, let me leave you with one very clear message. Today marks not just a launch of a mechanism, but the activation of collective resolve. The Incident Management Support Team brings together WHO, CDC Africa, and our partners under one unified structure, I can call, to move faster, smarter, and respond as one team. In Ituri and beyond, the situation demands urgency, demands coordination and trust. And through this IMST, we are strengthening all the three. So I believe we are not starting from zero. We are building on experience, learning from the past, and applying it with a greater speed and precision today. But success will depend on one thing, I believe. Our ability to stay aligned, like what we've launched today, to stay accountable, and to stay focused on the communities we serve, and to be led by the two governments of Congo and Uganda today who have this. So let us move together forward with clarity, with solidarity, and with determination to bring this outbreak under control. And my colleagues still on the ground, Dr. Chikwe, our emergency director, Roslyn, and all the teams of partners who are there, stay safe, and we'll see you again very soon. I thank you.
Thank you very much, Professor Janabi. Over to you, Dr. Tedros, for your closing remarks.
Yeah, thank you. I think my two brothers, Jean Kaseya and Janabi, have said everything. I would like to endorse what they said in order to save time. The only thing I would add is just repeating what I said earlier. This is a serious outbreak. And it is one we know how to stop. Of course, what's important here is the speed and the unity of purpose. So that's why we launched this plan together, because we believe that we're in this together, and solidarity and unity is our strengths. So with that, thank you so much to all members of the press for joining us today, and see you next time.
Thank you, Dr. Tedros, for your closing remark. That brings us to the end of the session.
And thank you to you,
Thank you.
Saran, and congratulations for your appointment as Director of Comms in Africa CDC. Thank you.
So much.
Congratulations. All the very best.
Thank you. Thank you. And thank you to Dr. Kaseya, Professor Janabi, and thank you to all the journalists. We will share the press release and the full Continental Preparedness Response Plan with everyone registered today. And if you need anything further, an interview, a clarification, a figure, our media teams at Africa CDC and WHO are available, and the contact details will go out with the materials. We have a press briefing every Thursday at 4 p.m. EAT as Africa CDC, and because it's a joint response, you will get most of the information. So we will keep you updated as the outbreak develops. Thank you and good afternoon. Merci à tous et à toutes et bonne fin de journée.